Good afternoon, everyone. This is Molly. I am the Executive Director here at the RAL National Association. If you're new with us, I am your go-to gal, and I'm the person that you would get to and talk to for anything and everything RAL. I am here with Robin Harris. Robin is a good friend of mine, and I've known her for many, many years now. She's known my family for many years, and she's helped us with insurance for a long time. And one thing that we have always looked for here at the association is a program that can help you guys as small business owners, and honestly, sometimes micro, small, extra small business owners, get major medical benefits. And I know from owning my own businesses, that can be one of the biggest struggles, is trying to figure out how to keep good staff and give them the benefits they need and still be reasonably priced because you are a small business. So when Robin came to me with this program, it was something that I had been looking for since I started with this company a year and a half ago. And I'm very, very excited for them to present it to you guys today. Just a little bit of logistics here. Over on the right-hand side is the questions tab in your control panel. In that questions tab, you can ask me any questions you need. If you can't hear, if you lose your slides or whatever happens, I can try and navigate you through that. Keep in mind, I will be sending the recording tomorrow, so you don't have to worry if you lose anything, if you came in late or anything like that. I can send it to you tomorrow so you won't miss anything. So at the end, though, is when we'll answer questions with Robin and Mike. So Robin will introduce Mike. He's here with her as well. And so I'm going to hand things over to Robin now. Robin, go ahead and you can take things away from here.
Thank you so much, Molly. Thank you for that great introduction. My name is Robin Harris. My company is Robin Harris Advisors. I have a health insurance brokerage, and I cover all things under the health insurance umbrella. That is your individual, your group, your Medicare, disability insurance, long-term care, dental vision, you name it, we have it here at Robin Harris Advisors. Because Molly had mentioned to me her very unique membership, I was looking for something to assist her community that she cares so much about. And Mike Balson, who I'm going to introduce you to, he mentioned to me that they have a new program called the Allied Affinity Program that is for memberships or membership-driven communities, companies, even I would say, what do you call that when, nonprofits, excuse me. So this is a wonderful option for you. And so that's why we came forward to Molly, and Molly said this is wonderful, and she just wanted to share it with you. So who we have speaking today about the Affinity Program is Mike Balson, B-A-L-S-A-N, and he is with Arizona Benefits Plans. Arizona Benefits Plan is the headquarter of a nationwide benefits company. And one of their specialties is organizations. And one of the things that I have found, even in my business, that the underserved is usually the smaller companies. And that is one of the things that we specialize here at Robin Harris Advisors, and with Arizona Benefits Plan are the smaller companies, mid-sized, even though we also do the larger groups. So Mike Balson, you there, Mike?
Yes, I am.
So without further ado, I want to, this is Mike Balson with Arizona Benefits Plan, and he's going to talk to you about the Allied Affinity Program.
Thank you, Robin. So let me get started here. As Robin said, this is a program through Allied National. They're the insurer. And as you can see by the slide here, they've been around for 50 years, headquartered in Overland Park, Kansas, and currently insure well over 100,000 members, and they do business in multiple states and growing. Let me tell you a little bit about this program. Now, I'm sure all of you are very familiar with what a PPO is, because many of you probably have such a program right now. PPO being that You have a network of medical providers that you have to use that are considered in network, and then you build your medical plan around that. But in addition to the PPO offering, we're going to have what they call their freedom plans. Now, something that's growing a great deal of popularity in the marketplace these days is called programs based on reference-based pricing. Now, what that means is that rather than base the compensation or the remuneration to the medical providers based on a pre-negotiated amount, it's really based on a percentage of Medicare. So for instance, doctors under the Freedom Plan would get reimbursed at 125% of Medicare. Hospitals are reimbursed at 150% of Medicare. Now, any doctor or medical provider that currently works with Medicare patients should more than welcome this type of program because it's reimbursing them more than Medicare would. Also, in addition to the Freedom Plans, for somebody that might have a little bit more of a limited budget is their Cost Saver Plan. Now, the Cost Saver Plan is really more of a limited medical type of program. I'll give you a brief description of one of the Cost Saver Plans. Now, it may still have a copay of $40 for office visits and $60 for urgent care, but one of the big differentiators between the Cost Saver and a standard major medical plan is for an inpatient stay, for instance. This plan may only reimburse $500 a day. So anything beyond that, you'd be on your own. And it carries a $35,000 per year maximum. But for somebody who has a limited budget that just wants to have something to cover basic major medical, the Cost Savers are certainly a viable alternative. Now, for the PPO I alluded to, it would be covered through the Cigna National Network, but we also have a couple of options if, based on where you're located, the PHCS network or the First Health Network could possibly be a better fit for you. We'll just look at that on a case-by-case basis. So let me go back to the reference-based pricing, the Freedom Plan. Like I said, it's a little bit different than the PPO in that the physicians are reimbursed at 125% of Medicare, hospitals and other providers at 150%. But one of the big advantages to the Allied reference-based pricing program versus some others, you'll see there where it says a no balance bill guarantee. So here's what happens. Let's say, for instance, you go to a doctor and they take your ID card and they said, okay, that's fine. You go through your procedure, but lo and behold, you get a bill for maybe a price difference between the 125% of Medicare and what they want to charge. That's called a balance bill. This program has a no balance bill guarantee. So if you were to get a balance bill under this situation, you'd simply call Allied. You'd tell them about it, and from that point, you are totally absolved of any responsibility for that balance bill. Allied picks it up and handles it from there. I just want to make sure everybody understood that. It contains a no balance bill guarantee. And in terms of cost, premium cost, the Freedom Plans usually come in anywhere between 20 and 30% less on a premium cost basis than the PPOs. Now, for the program that Allied's put together for associations, they put some enhancements in here. We talked about customized plan options. They would contain only a $10 office visit copay for your primary care physician. Telemedicine. Telemedicine over the last few months has gotten a lot of publicity. And Teladoc is probably the top in the field. And what's nice about this program, we've been able to employ Teladoc with a zero copay. So what that means is that for something of a more minor nature that you have wrong, instead of having to, gather up the family in the car and go and visit your doctor and make an appointment, you can simply pick up the phone and call Teledoc. From that point, the person at Teledoc will ask you a few questions. Then usually within about 15 minutes, a doctor will call you back. And then you will talk to the doctor about what kind of condition you have presently. And in more cases than not, they'll be able to give you a prescription. They'll do everything over the phone. They'll ask who your local pharmacy is. They'll call the prescription into your pharmacy and you'll be done. It's that simple, zero copay. It's beautiful. Also contained within this program is your lab work is picked up at 100% through Lab 1. Diabetic supplies are also picked up at 100%. There is an international mail order feature that you have the option of using that has a zero copay. And there's also some additional discounts for things like chiropractic services. Now, the next point that you see on the slide, healthcare assistant. And I want to talk about that for a moment because it really is a nice feature of this program. What the healthcare assistant is, if, say, for instance, you need a chiropractor, you need to go see a chiropractor, but you don't know one in the area. Well, you would call the phone number that's provided to you and talk to the healthcare assistant and allied and say, for instance, hey, I need to go to a chiropractor. Who can I go see in my area? Not only will the healthcare assistant give you some options, they will also tell you who the least expensive of the chiropractors are, so you can make your decision accordingly. And it's the same thing with anything else relative to your medical care. I've seen people use the healthcare assistant, for instance, if they knew they had an upcoming hospitalization. You would be surprised how the fees of various hospitals may vary, local hospitals. Well, if you had to go into the hospital for something, you call the healthcare assistant, tell them what's going on, and they'll advise you in terms of who the least expensive hospital in your area would be. So I would strongly recommend using the healthcare assistant. It's a really positive feature that's there for you. As I said, the Teledoc through the telemedicine. Once again, I strongly encourage people to use it when they can. It's a zero copay. It's a 24/7, 365-day access. The lab benefit program, the 100% lab fees through Lab 1, that's part of the program. Diabetic supplies. Diabetic supplies picked up at 100% with no cost to the members. And once again, that's another thing to use the healthcare assistant for. If you need diabetic supplies, they will steer you in the right direction and make sure there's no cost for you. As I mentioned, the international mail order that's available with a zero copay, and you get a 90-day supply of your prescription. You'll have all the information on your ID card for that as well. And this program also has some little extras, like there's about 9,000 fitness centers around the country where you can get a membership for simply $25 a month. So that's another point that's available. I've already talked about the healthcare assistant, and I can't talk about it enough. It really is a great feature. But you can use them for obtaining, like I said, free diabetic supplies, finding the lower cost hospital in your area, as I mentioned, and even in the case of a mental or behavioral health situation, gaining guidance from them as well. And they, of course, support the funding advantage members, whether or not you're on a Freedom Plan or a PPO. So, folks, that's pretty much it. Wanted to know, is there any questions immediately? Molly, did you have any questions come up?
Yeah, we have had a couple questions. I know that was quick, everybody. So if you have questions, go ahead and type them in. I will have you go back to, or forward maybe to Robin's information. So you will reach out to Robin directly if you have questions on exact pricing. Okay, so this is where I knew these questions would come up immediately, right? Is this good across the nation, Washington, D.C. area specifically, or do you have a list of states that you can give us, or do you know like a general where this is good for people to use?
I have a list of the states that Allied is working in, but we can accommodate other states that they're not. We have other carriers we're able to use as well.
Great.
It's for the same exact program.
Perfect. Okay. So, you know, everybody's asking about specific areas, places like Nevada, Washington. I know I see your questions. I would reach out directly to Robin. Robin's information is on the screen right now. They can accommodate you. So this is a great program. This is a brand new program. They're bringing this to us because you guys are members here with the association. So this is why I'm here talking to you guys about this. I didn't want to give you guys too many details today, as there's so many different directions this could go, right? Let's go through
Molly,
these. Yeah,
excuse me, if I may, I want to make sure I emphasize this. This is a group insurance program. It's not individual coverage. And it is, though, for groups that employ 2 people full-time or more that are not related. Okay?
it's a
So if
very
you've got
small
2 people, it's fine, but it can't be a husband-wife.
right.
You have to have a third person.
But if
Follow me?
But if one of the employees is a son that maybe lives out of the house, that would be fine, right?
Yeah, it's supposed to be 2 people non-related.
Not related, okay. Thank you very
Not
much.
related.
Okay, because we see a lot of that.
Mm-hmm.
Right. So that answers some of the questions. I know a couple of you asked for these plans, individual plans or group plans. So this is based off of you having a business, right? So as a care homeowner, or many of you own other businesses, as small business owners, this is to assist you with as little as 2 employees that are unrelated, which is a very, very small group, to get insurance coverage. All right, here, let's go through the next ones. Do you have a certain amount of employees to get lower costs? Okay, so 2 employees, right? Does it change the cost of it if you have more employees?
Well, premium is always based on demographics.
Okay.
So if you have, let's just say you have 5 people, and group number 1 is 5 people with an average age of 50 years old, and the second group is a group of 5 people with an average age of 30, well, the 30-year-olds are going to have a lower rate.
Which makes
Follow me
sense,
on that?
right? Going to have less health issues, supposedly, right? All
Correct.
right. Does it cover durable medical equipment? So you did say insulin pumps, right? Anything insulin related, or just supplies? Do you know?
Well, it does cover durable medical equipment, yes.
Okay, great. So durable medical equipment, Byron, that's your answer right there. That's great. Like I said, guys, this is a great plan. So I'm excited to share it with you. I know Robin would be excited to give you more details. And this PowerPoint, here's another question. The PowerPoint, I will get this from Robin tomorrow. I'll also be sending out the recording. So if you want to go back through, do you guys have a brochure I can also send out? I think you did send me one, correct? Robin?
Right, there's a one-pager that has the main benefits on it.
Great. So I'll send that to you guys as well tomorrow. So with this recording that you'll get tomorrow, and everybody who didn't get to attend will get that as well, I'll send out the brochure and this PowerPoint presentation. And anything else Robin thinks I should send as well.
Yeah, there were so many great benefits here. The fact that the balance bill guarantee, the ACA compliant, the $10 copay, free teledoc, 100% coverage for the lab. And what I love is the international pharmacy benefit. The reason why that's excellent, it lowers the price for the overall group for brand name drugs. Am I right on that, Mike?
Correct.
All right, so we got so many questions coming in, guys. This one says, I travel a lot and I have 2 care homes. Will this cover me in 2 different states? So this may be something you guys see a lot, actually, because I know I have members that have homes in different states.
Right. So let me give you an example. So let's just say somebody's covered under the PPO. Well, and they're covered under the Cigna network. The Cigna network is a national network. So if somebody is, let's just say somebody's located here in Phoenix, and has to go to Dallas. They'd be covered in Dallas by the Cigna PPO network there, because Cigna is a national network.
Right. And so you said pricing is determined based off of demographics, like you said before, right? Pricing is not determined based off of how
pricing
big the
is
group
based off of a combination of demographics, and Robin will be supplying them with a form that'll ask a few health questions and that information as well.
Right. For those that want to find out pricing, we can forward the applications over to them.
Absolutely. And what we'll do, and I'll be working with Robin on this, is we'll take a look at their current program if they have one. And we'll, of course, do our best to try to match the benefits of that program, but we'll also shoot some alternatives their way too.
Yeah, you know, I've had this question come up a couple of times. I'm not sure what you said that may have triggered this, but is this program for only people over 65? That's not true. For some reason, somebody thought this was for seniors. This program is for seniors.
No.
No.
No, this is not for.
I did
Go ahead,
mention
Robin.
in the beginning under my brokerage, I do cover over 65, but no. This
Okay, great. Perfect. Yeah, so that answers that question. I thought that was just a one-off, and then I saw it in there a couple of times. Here's an interesting question that you may or may not know the answer to. Does hydroxychloroquine prescription covered by the plans? Do you even know?
It will be covered if the doctor orders it, like any other prescription. If the pharmacy, is going to fill it out. If the doctor orders it, yes.
Yeah, absolutely. So one of our students says they haven't opened their RAL business yet, but will she be qualified to purchase? So you have to be a business, right? It's a group plan. It has to be your business and your W-2 employees, correct?
Correct.
Right. And then she says, do you sell Kaiser?
No, the Kaiser network is totally different. It's I believe, based out of California.
California.
Great. There's your answer for that.
That's a question they could call me and I could get them more specific if they wanted a plan that covered Kaiser.
Right. And Hans, if you're looking at signing up or getting specific terms for your area, it looks like he's in Texas. Robin's information is right here. Her phone number is right here and her email address. I will also be sending all this information again with the recording. So keep that in mind. You'll get the brochures, you'll get the recording, and you'll get the PowerPoint presentation so that you'll have all of this information tomorrow.
And I do want to mention if you are a group that wants a group plan and right now you're thinking, oh, I could never do it, I can never afford it, I would quote it anyway just to see. But if you find out that it's not in the budget, you could speak to me and I can give you ideas of what to do otherwise to give some kind of coverage to your group that's more in the budget.
And we could always run one or two of the cost saver options for you as well.
That's right.
Perfect. Is the Lab One the only testing center you can use for the testing?
Well, they're the ones that you'll get the 100% or the 100% coverage with. So what you typically would do is, doctors are good at, but you mention to your doctor's office, and I always make this a point, hey, if you're going to do lab, can you use the local Lab One?
Right.
And they have no problem with it. Lab One is nationwide.
So someone's asking about home health. So basically if you have more, any of these businesses, if you have more than 2 employees that are W-2 with you, then this covers you. You're a business with two W employees that are not related, this will work for you. So that answers that question. Okay, so can the 2 people be the owner, manager, and 1 staff member? So a manager and a caregiver? Yeah, absolutely. I don't see why not. You all work under the business. Just think about the business. If you work under the business as a W-2, you're an employee, that works for you.
Yeah, as long as we're not looking at a husband and wife situation.
Yes. Non-related people, is that okay?
Excellent questions.
Yeah, everybody's super excited. Sounds good. Thanks for the info. Thank you. Lots of thank yous. Thank you. Thank you, everybody. I know. Look how great this is. Okay, this says, I have 7 employees, specifically one husband and wife couple that has 2 children. Is there an affordable family plan? That's a good
Yes,
question. Okay.
family coverage is part of this. Typically, when we produce a proposal, you'll have a rate for a single person, another rate for an employee plus spouse, a rate for employee plus just children, and then full family rate.
Great. And so that gives them options for sure. That's awesome.
Correct.
So that's the twins. So I hope you guys reached out to them. I love these guys. So if the twins reach out to you, you'll know because they are the best. So, and all my other members are amazing too, but the twins are a hoot. So I love you guys. I'm glad you guys are here. They're always at all of my webinars. So that's great. All right. Adele, please reach out to Robin. Robin's information is here. If you'd like pricing, anybody that wants pricing, please reach out to Robin directly. She can get you a quote. And long-term care, Robin can help you with long-term care insurance. Absolutely. Reach out to Robin. Her information's here on the screen. Do your providers need to be appointed with Allied in order to be paid on this plan? It's a PPO. That's not true, right? You could go to whatever doctor, or is it a...
Well, let me explain. So if they're part of the Cigna PPO network, if you chose a PPO plan, yes, they need to be part of the Cigna PPO network. But that's fine. If they're part of the network, yeah, absolutely, they're good. If you go with one of the Freedom Plan options, the reference-based pricing, you can go to any medical provider. There is no network, and there is no out-of-network.
And this is a great question that I had thought about too. As an owner of the business, can you be covered with your employees too?
Of course.
Okay, that's what I thought too, yeah. What about, let's see, is this only available a certain time of year, or is it all year round that you can get on this plan?
It's all year round.
Great, great. Look at all these awesome things. He's got all these good answers. There's no negative answers so far. Look at that. Can we get special cancer therapies? Do you know how they deal with cancer therapies?
Well, the thing is, it would have to be FDA approved. I know that much. And I would think so. I mean, it is a major medical policy.
Well, and if I could jump in, that may be that type of therapy in terms of finding a quality provider in your area of that type of therapy. I would use that healthcare assistant. I can't stress that service enough. That's a wonderful service that's attached to this program. And if you call the healthcare assistants, and you'll have the phone number for that, tell them what you're trying to accomplish, and they'll give you the proper guidance.
That's great. And you know what? That's really wonderful, because a lot of these phenomenal programs like this, they really are taking an extra step and giving it sort of a concierge type of approach to their members.
Yeah, and I didn't hear anything about it, but what about dental and vision? Is there dental and vision with this too, or would that be an add-on?
Yeah, that would be an add-on. We could definitely help them with that.
Okay, great, perfect.
And what's great is they would get the group price.
Yeah, that's great. Okay, does the laboratory benefit cover COVID testing?
Yes, they have to. They have to. That was an agreement with the president and the health insurance carriers.
And it's free.
Right, but I want them to keep in mind, this is what I have been seeing, and this is what has happened in the last, since March, is that when you go to the doctor and they're screening you for COVID, many times they're screening you for a lot of other testing to rule things out. So that's why in this particular case, you want to go to that lab one.
That's a great idea. Yeah, right? Go to the specific lab if you want one of those tests that's going to do everything, right?
Yes.
Okay, great. Oh, I got a lot of people saying they're going to call. They're like, I got to go, but I'm going to call. So great. Thank you, CJ. Well, that was my last question so far, but this is why, oh, wait, here we go. Hold on. Can we get fast COVID tests? So it just depends on the lab, right? So if you're going to go to lab one, it's depending on the lab and how backed up the lab is. So if they have a quick test, absolutely. I know some of them do the saliva test, or they do the pin prick on your finger test, but those are all dependent on the lab that you go to specifically in your area. It may not even be dependent on the lab nationally, just specifically the lab locally and how busy they are.
That is true.
All right, you guys. Well, this was great. And I know that you guys probably have a million questions. And so, Robin, I hope that you're prepared to answer all of those questions. Everyone's going to be reaching out now.
Right here.
So reach out to Robin. It's Robin at robinharrisadvisors.com, or you can call her at 602-663-2810. And thank you so much for joining me today, everyone. Thank you, Robin, and thank you, Mike.
Thank you, Mike.
If anybody has something specifically that they feel like we should do an entire webinar on that was related to healthcare, I'd love to have Robin and even Mike back, and we can talk about those things. I know that this is a big subject with lots of different facets, and I know we could go and talk into this. So if you guys have experiences, or if you have things that you have questions about that you don't understand, I'm happy to have them back. So let me know, guys, and I will send you everything tomorrow. Have a great evening.
Thank you all.
Thank you, folks.